And I know you were really nervous. We got you numb. How was that?
Didn't feel a thing. Not even a little thing. It was great.
That's awesome here. That's what we shoot for. Not feeling it at all, because I know that's a huge fear for everyone. Jen, would you put up the X-ray and we'll show the tooth? Do you mind if I show in your mouth?
I don't care.
Thank you, buddy. All right, here we go. So we are taking out 12. This one is broken off underneath, and it's not savable. So we're going to be taking it out and putting an implant in today. And unlike almost everywhere else, we're actually going to put a temporary on there. So instead of having a hole for 4 months, or having to have something that a retainer with a tooth that comes in and out, you know, that covers your whole palate, we're going to put a tooth on there. It's going to be a little out of your bite, so you don't bite on it.
You wanted me to bring? I had one done recently. They just did a bone graft. They didn't put the post in or the temporary. I have to wait the 4 months to go back and then have the post put in, let that heal, and then get the permanent put on. So
yes, and that's the way almost everywhere does it. Where you take out a tooth, you put a bone graft in, let it all heal over 4 or 5 months, and then put the implant in, let that heal for 4 or 5 months, and then put the crown on it. It's a very drags out the process, and in the meantime, you don't have a tooth there.
Right.
So this, if we're able to take out the tooth and put the implant in the exact same time, one, it gets the benefits if we can put a tooth on there.
Right.
But even more important, the bone that's around that root right now, if we take out the tooth, even if we put a bone graft in there, that's still going to shrink up a lot. We're going to still lose critical bone. So if we can put the implant in right away, we get to preserve all that bone. So it ends up being by far the best result. We get to maintain the most bone, shortens the treatment time, and you get to have a tooth, in the meantime.
And with where this tooth is located, that makes me very happy.
Exactly. Now, I will say, if we were doing a back tooth, I would propose not having a temporary on there, if you didn't mind, just because while it's healing, we don't want you biting on it. And a molar in the back, this is not a molar, but if it was, and we had a temporary back there, there's a lot more surface area for you to accidentally chew on if you were chewing over there. So with this, I'm going to make a temporary, and we'll make it a little shorter so you're not biting on it while it's healing, but at least you won't have a hole there. So, all right.
Sounds good.
And this is where it's broken off, the gum line under there. So there's just not enough tooth structure under there to rebuild. Well, there's our temporary. It's in place. Now we have it a little bit out of the bite. If you can see, I made it a little bit shorter, so there's a gap, so when you bite down, you're not touching it.
Mm-hmm.
Now the final one, after everything heals and we make our final crown, that one you'll be able to use normal, and that'll be fully into your bite. But for now, we don't want you biting on it. So while this implant heals. Okay, so this is what we did. This was the tooth. The crown was broken off, and whoever did this tried to do a post in it to save it, and they missed. And that was part of why it came up the side, and this was all infected here as well. So that's why that tooth wasn't savable. Out it came. Here's our after. So here's your implant. Got a big strong one in there. We got our temporary cemented on here. So again, you want to not chew on it for these 4 months. We got it so it's out of your bite. So just chew on the right side for the bowl. Especially if you have like a piece of meat or something with some bulk to it.
Right. You
don't want to bite on that side. So just kind of avoid it. 4 months is how long we need to let it heal, and then we'll take that off, take our impression for the final crown, and then you can use that one like all the rest of your teeth.
Right.
So how was it?
Wasn't bad. Quicker than I thought too.
Yeah?
Mm-hmm.
Took about 20 minutes for us to take it out, put the implant in, and about another 20 minutes to do the temporary. So.
Works good. Thank you very much.
Yeah. Any questions?
No, I don't think so.
Thanks, bud.
Appreciate it.
All right, so.